Hello, everyone. This is Mark Anthony with AI Edge Promotions, bringing you the best of the best doctors in their niche, within their product, and with what they do in their area. I'm really excited that we have Dr. Daniel Schneider coming out of California. You can take a look at Dr. Schneider at schneiderchiropractic.com. That's in the Mountain View, California area. Dr. Schneider not only does chiropractic, but he also does neurofeedback. And those of you that do not know what neurofeedback it is, there are so many logistics of that, not just of the healing of the mind, but also inner healing. And so today our topic is going to be why neurofeedback and other techniques are so powerful to healing the body. And before we go into that, Dr. Schneider, if you wouldn't mind maybe just telling us just a little bit about yourself and how you got into chiropractic and how long you've been in the game. And again, thank you so much for being here.
Well, thanks for having me, David. A lot of things actually got me into chiropractic. It's like one event leads to another. If you were to think that if you realized that where they would be heading, you would have no idea where you were going to end up. So I started out with martial arts and study of movement and got involved with the Chinese idea about kung fu, where the healer was also the warrior. And that made sense to me. And so I found that in my studies of that, it made me more interested in healing. So then I learned body work. And from that point, then I came to crossroads where I realized that I wanted to deal with somebody who could look at the body from a larger perspective. And in that relationship, chiropractic seemed to be a very rich environment in which the doctor could look at the biochemistry, they could look at the way a person moves, they could look at different neurological assessments, or they could look at exercise. All of these things then would come together in one larger picture that you could use rather than just specializing in something and saying, well, there's your diagnosis and that's what we're going
Right.
to do about it. I didn't find that to be particularly interesting. And it was pretty limiting in the way that I could influence people.
Wow,
So,
that's awesome.
so the just a little correction there. I did have a practice in Mountain View. However, I am in Ventura now in Southern California, and I have been a chiropractor for this is I think going on my 40th year. So I'm beginning to get it down and having a great time doing it. Never was sorry that I picked this profession because it's so rich and growing, and it has so many wonderful pioneers in it that I've been privileged to learn under. As a historical, idea about how I came to do the kind of chiropractic that I do, was that what your question was?
Yes, yes.
Yeah. So then, I got my license in 1986. I came across applied kinesiology, and that was really a life changer for me because it pulled together all of the elements that I had been studying, like with the Chinese
Right.
medicine and the like. And they looked at the body as an integrated whole and all of the signs that the body would exhibit when it would go through movement or digestion or different muscle activation techniques would give you a larger viewpoint so that I was able to, like I said, take the larger pictures and then bring them down into a focus of this is an interesting area that I find in this patient. And
Right.
this may be one of those, this may be a wonderful entry point that we can use to make a difference in their life or in their complaint that they are looking to change. Or there may be something else that they're not even aware of that may be contributing to this
Mhm.
complaint. So I have a kind of reputation with my patients from looking at things that way, and they say, "Well, I'll come in with a shoulder problem, and he'll work on my foot." And they do that with affection, I like to believe, and that we're able to find perhaps the most effective way that we can make a difference in this person's life and achieve their goal. And sometimes a shoulder is a shoulder. So, study of applied kinesiology and continues to be a very rich environment that I find myself in. And I use that study. And also, I became involved in functional neurology at the around 2002, and have found that an interesting also entry point that I can fine tune my analysis of, say, a patient's problem and see where in that central nervous system there might be a problem that I can influence other structures with. Maybe it's up in the brain that if we stimulate, say, a visual field, or if we stimulate a certain point along the skull, or if we maybe use a stimulant like a laser or electromagnetic field, or a muscle stimulation technique that we can use to go in and stimulate the central nervous system or the peripheral nervous system in order to achieve our goal too. So it's a really rich environment. And that's how I became involved in those two studies. And like I say, they're a rich environment that keeps me busy.
How do you see neurofeedback maybe changing the culture of what's going on as in medicine and stuff like that, in healing of the brain?
Well, neurofeedback is a vehicle where you can take literally a map of brain function and get an idea about the different areas of the brain that would be working at certain rates of speed that would be seen as normal, or might be running too high or running too low. And that can give you an idea about the area of the brain that might be able to be trained to a more appropriate, quote, normal level of function, according to studies that have created normal feedback loops that you can fit within a range and still be considered normal.
Well, do you see neurofeedback? What are some of the cases that you've noticed, say, within your clinic, that you've helped many people with, say, neurofeedback, where they were struggling with certain things? Maybe they weren't doing too well. Now they're doing well now.
Well, there's many conditions that can be influenced by it. One would be, attention deficit disorders, anxieties, depressions, anger reactions, difficulty with memory patterns, excitability, inability to focus mentally. Yeah, anxiety, things like that. Quite a rich, that's a pretty large field of involvement.
And how long have you been using or been working with that niche, that niche right now?
I got involved with neurofeedback in 2013.
Okay.
And found that was a great time to get involved with it. It was growing by leaps and bounds at that time, and so I rode that wave, and it was really very enlightening, and was interesting in that you can also take somebody who is, say, quote, normal, who wants to operate at a higher level of function. And that's where I have enjoyed working quite a bit, in that I like to create the greatest opportunity for us to experience our life.
100%. Are there anything in maybe, do you feel like in neurofeedback we've maybe hit the thrust floor, or do you think we're just barely scraping the surface with it?
Oh, we're just scraping. We are just beginning. There are elements of mapping the brain now where you can take, rather than a general field of function, and
Right.
bring it right down into different parts of the brain. Like, for example, say, Brodmann's areas. You've seen pictures of the brain where, they look like these. It looks like this little, corrugated
Right.
surface that has just kind of sucked in on itself and is wrinkled. And all of those different wrinkles have specific function associated with them. So by really zeroing down on their brainwave activity, you can get an idea about something that might be happening in the parietal lobe in one of the Brodmann's areas that is specifically associated with an awareness of what's going on in your foot, or all the way up to your, tongue, and all of the points of the body in between.
Right.
This one small area of the brain that you can get an idea. This might be where a person has an attention deficit related to that certain part of their body, which might make them have a difficult time relating to its function or its purpose in their life even. I see
Wow.
this structure, but I don't know what it does. that's an example of a far end example of a brain imbalance that can manifest in different levels of awareness of the body. And it could also be a minor thing, like, for example, with, say, tennis pros who
Right.
want to operate at a higher level. They might find an area that is not giving them proper feedback from certain levels of their brain that are associated with their awareness of where their hand is, and by extension, their racket is in space. So by fine tuning that, you can get a greater experience of, well, yes, well, my racket is right somewhat over here, but no, my racket is right there.
Mm-hmm.
And this makes the difference, in getting the point or getting the curve on the ball or whatever it is.
100%.
And that's really the exciting part of neurofeedback that I like to pay attention to. Taking a quote normal person and looking for something that you can improve on.
I like that. Is neurofeedback, are there any studies where it actually helps out with the eyes?
Well, the eyes are
Different subject, probably.
that is, well, it's not really a different subject. I don't have a study that I can quote to you now, but I can sort of give you an idea that the eyes are really not a great deal different than another part of the body. The eye, or the hand awareness, or the eye awareness,
Right.
travels to a certain part of the brain. The image that we take in from our visual field, that's not the end of the discussion. That's just a superimposed stimulation on our optic nerve that gets transmitted to
Right.
different parts of our brain that then decipher what that means in our life and how we can relate to that. So that travels down to the back of the brain, actually, into the occipital area, where the brain gives it a shape, gives it a feedback, and then transfers and meaning out to different parts of the brain that then say, oh, this is meaningful to me. I can respond in this way.
Well, okay. Yeah, I probably started hitting on neurofeedback probably about 2021. So I mean, I'm still in the baby stages. I know that I went through a lot of seeing a lot of the studies through like claremind.com.
Yeah.
And so I bought a couple units, so I'm still kind of playing with them.
Okay.
Don't have the big one, the big unit, the one where you put you put it over your head and you can see exactly how fast the brain's moving
Sure.
in conjunction on how slow it is.
Yes.
So, but yeah, is that the one that you're currently using?
I use that. And I also I may be using the smaller unit that you may be talking about.
It's got the glass, like the 8 glasses with it.
The glasses and the ear and the headphones.
Yeah.
Yes, yes. It's a fascinating little tool that you can use, and it travels.
Yes,
So
it
that's
does.
helpful.
I call them the Terminator glasses because they're blinking.
Oh, yes, yes.
See, I have the old school one. You might have the newer one. The it's just the black box. They have a white box too. I just have the black box, the old school one.
The old school one. Okay, so I have something that looks just about like an iPod
Yeah. Okay.
type size, and so that I can program that then to stimulate visual and auditory fields to accomplish your goal. Whether it's to
Focus more.
focus more, to get more of a to go into a relaxation state, or to change a traumatic brain pattern, to move a person through a particularly disturbing memory pattern that they might be having to deal with.
Have you worked with a lot of people that maybe are having say they've had some trauma in their life and they have these memory patterns that just keep repeating every day? And if so, how long did you maybe see that it took to maybe for them to start seeing some significant changes?
So when dealing with traumatic brain memories, that is all over the map. That depends on the person's life experience up to that time, their motivation to move through it. Some people, when they are dealing with a traumatic memory, they might not even be the least bit interested in going there.
Mm.
It is a matter of finding the interest level of going through it, because sometimes it can be, enlightenment can sometimes be exciting, and sometimes temporarily a little bit scary, going through the field that you want to get to the other side of.
Right.
So with that in mind, let's say that a person is dealing with a certain emotional pattern that they may not even be aware of what brought that on. They just know
Mm.
that it's disturbing to them, and it might be, probably is disturbing their life, smooth life movement, and prevent good outcomes that they wish to have. Whether it's pushing away opportunity, or getting inappropriately angry or fearful, and avoiding certain social situations, or other types of
Mhm.
professional or other situations. And in looking at those patterns, there are different ways of assessing that. And in speaking with a person, or in sometimes I will use my applied kinesiology training to muscle test for different emotions that they might be feeling, or certain
Right.
causations that they might be going through, and have been somewhat successful in determining time periods when they might have taken this on. So in a way, it allows us to cut to the chase, if you will, to say specific time events, and save quite a bit of time and determining, okay, where is this coming from? How did it happen, and how did it affect you? And that then would give us an idea about best way to go into correction. And in the case of the lights, sometimes I have used them to have the patient focus on traumatic event, but to do so in a way that is non-threatening and is separate from the event,
Right.
while they so basically they're a passive observer of this event.
Mhm.
And then as the audio signal comes in and changes, stimulates their pattern, the video lights come in and change. It can take that memory pattern and, like furniture, move it around to
Hmm.
where it may be a different meaning to them. And then going through various brainwave actions, maybe 4 different brainwave actions, in order to get to the end where you are actually then repositioning that furniture in the memory pattern to a more appropriate place. And often a person will find that they feel a lot of change in their excitability. They'll feel calm, collected. Their brain is quiet, and they'll go forward from there. And generally, those patterns, they take repeat um, sessions, because what may be liberated in one day may reveal another event that might have been generated by that again. So you're looking at sort of layers on a field that you're going to have to go through in order to move that off, then move the next one off, and go forward. And what you find when you do that is that it becomes not as traumatic of a experience to have these things intrude on your life that were impeding your ability to move smoothly through it. And then it becomes actually, I find that people are more intrigued by it rather than put off by it. It becomes an interesting thing, interesting adventure.
Wow. What would you say that, for me, I look at neurofeedback. I've been using it, and I've noticed that when I first got on it, there were, Denise was saying that your brain is moving very, very, very fast, very abnormal fast. And the first thing I said was, I don't want my brain to slow down. I like it.
Yeah.
No, she was like, what? We just need to slow it down just a little bit. And you know what? I also actually noticed the difference, because I
Yeah.
was running to the point where I was talking and I was already thinking of the next thing that I was going to say, of the next thing, of the next thing, of the next thing.
Right. So you're getting ahead of yourself.
100%.
Yes.
So now I'm able
Oh,
to
yeah.
be more methodical about it.
Yes. And probably you're finding that it doesn't get in the way of the speed of your brain, cognating, coming up with thoughts and reasoning through things.
Mm.
It might make it more orderly, and it might actually speed up the end result of what you're looking for.
100%. And what's interesting about that is when you start to realize, see, at first someone tells you, you don't really even notice it. You're like, whatever. And then when you start noticing, okay, I'm slowing down, I'm being more methodical, My decisions are more precise. And it's interesting. You start to realize, well, I actually had a lot of holes in my thinking process because I was moving way too fast. You have ADD, you have ADHD, you have all these things that, we've been taught that it's a curse or it's bad. I always look at things flipped. Everything's a blessing if you look at it, because you can use what seems bad for good.
Exactly. To use, a different term, I like the term opportunity. It
I
really
love it.
is to wow, this, I mean, like with different forms of autism and those things, that runs on a spectrum. It's not like
Yes.
this is autism, this is not. This is kind of a spectrum that it runs along. And those people with Asperger's or different, they are gifted in that their brain is engaging at a higher speed, a
Correct.
certain part of their brain, but at the expense of the opposite side of the brain. So they might be able to do just incredible things with mathematics
Yep.
or something like that. But their ability to relate it and to explain it and to be, sociable in the way that they engage, it's at that expense. So what you can do then is that's an example, of say having a brain operating at warp speed over on one side, but then at the deficit of the other side. If you can help to bring that back over and to bring the speed of the other side up,
Right.
and you can create a more balanced function, which certainly the person would perceive as less anxiety inducing. They would, and they, prefer to have that feeling because that's the way that we are supposed to be wired. That feels normal to them.
Exactly.
And some of them maybe have never experienced that. So,
I,
yeah,
yeah, I would agree 100%. I think a lot of people actually have not experienced this, especially like we have so much going on in the chiropractic world that people don't even understand. We have a lot of doctors that are now not just chiropractors, but they're in the neurology, they're into the regenerative medicine, and not realizing that in your guys' field, whom I look up to, you guys are learning all the time. It's like nonstop because you're getting better at how can I help more people, not just put a band-aid on it, but how can I help heal the main spot so that, like you said, the neck isn't always just the neck.
yeah, yes. And it's interesting, the people that have been drawn into the field of, let's say, example, applied kinesiology or even
Hmm.
functional neurology, it's a big tent. It involves medical doctors,
Yeah.
involves osteopaths, people who have license to diagnose are all welcome in it. And it has something to offer those folks. So if you find a medical doctor who uh, has studied in the field, you'll find them to look at things from a much different perspective to where they can include other forms
Hmm.
of, say, treatment or consider other things in a person's diagnosis that allows them to be more effective in
Hmm.
achieving a larger outcome for a person.
Yeah, very true. A lot of people don't talk about there's so many avenues to what you're just saying right now. I mean, not just to the healing of the brain, but I think it's very soul internal because people will say, "Well, I was born this way. I can't get over this. I can't get over this memory, or this is DNA. It's from my mom and my dad and my dad's sister."
Yeah.
I mean, I don't know how many times we can really even go after that. I believe that you are your own person. Yes, I believe that sometimes there are some DNA factors, I guess you could say, but I don't know. What are your thoughts on that?
Well, DNA, that's kind of an up and coming field. The study of that. I mean, and again, that is just barely scraping the surface. And if you look at the parts of the DNA that are activated in a person, that's not every part of DNA is not active in a person. Some parts of DNA are never expressed. That's a good thing because they might be a bad expression, something going into a disease state or a brain behavior pattern or what have you. But uh, the field of and these other areas like functional neurology can also take and stimulate certain genetic traits that can be beneficial. So you could even do a map of a person's genetic material and see
Mhm.
where their potential for good and bad is, and then work to nurture that area toward the good outcome, whether to keep that bad DNA expression quenched and
Mhm.
to stimulate another part of their potential to become more active. And, from that standpoint, then I agree with your previous point that you were making about people tend to want to own who they are. This is the way I was born. This
Yeah.
is who I am, as if this is the sum total, and this is, I don't want to change it, usually because they're not sure about what's on the other side. But when looking at those elements of the reticence that a person might have to, exploring their potential, like the analogy I was making, with the tennis pro,
Mhm.
um, uh, it I have never seen it be harmful for a person to explore their potential in a way that allows them to improve upon their abilities and
Right.
who they might self-identify as, a year or 5 years or 10 years hence after they start that journey about,
Mhm.
wow, what if? And so it's, boy, what a rich field. And that is where I find the most reward in working with people to take their problem, take their, disease state, work with them to improve their self-expression so that they can come out in a healthier state, which then will make them more capable of, becoming the best person that they can be. And
I
so,
like that.
yeah, that's a very rewarding part of the work.
Well, you and I were discussing something about you were talking about getting in with red laser therapy and how it was kind of something in conjunction with what we're discussing today, neurofeedback. A little bit more about how those kind of mix together, or how you're working with those two, as in things that you're seeing maybe some really big changes.
Laser therapy is something that I've become fascinated with its ability to change a function of a tissue or to change the brainwave activity of specific parts of the brain by shining a light on different areas of the
Mhm.
brain, depending on where you have found a problem to be approached. If it is associated with, say, a certain awareness of a certain area of the body, then you might shine a laser, on a
Mhm.
specific area right there to go in and create a change in brainwave activity. And by doing it in a repeated pattern, you can change the behavior of that brain. And in conjunction with other healing activities, come out with the best example, like using neurofeedback for stimulating that part of that brainwave activity, but then
Right.
also going in and stimulating it from a different perspective. That's a different way of creating a similar effect, which then makes the outcomes greater if you approach then say a person's digestive pattern. Let's say that they have a leaky gut, which is a term used for inflammation in the gut, allowing in foreign proteins that don't work
Right.
well. That can also, one of the sequential events then is to leaky brains can develop. So that's another way that you can go in and create a greater change using individual types of therapy to a greater end.
So, what I hear you saying, correct me if I'm wrong, to stimulate the brain, let's say we're utilizing the neurological part, we're using the neurofeedback part, and it's stimulating it. So, once it's being stimulated, and there's movement, is that when you put the red light therapy on it?
Absolutely, you can
So
do that. You can
at the same time.
Sure, you can piggyback different things on the brainwave, and as I said, you can also use a little electrostim, a muscle type of stimulation, or a
Right.
micro stimulation,
Right.
going in and stimulating that area again. So you can do different
Wow.
things that can go in there and just up their game and up their response and their ability to come out the other end, operating in a much more effective pattern.
Wow, that's really cool.
Yeah,
Okay.
it's
Wow.
exciting.
That takes red light therapy a little bit. I like that, to kind of to another level in my brain. It's smart because you've hit that area to where there's so much movement going on. It's in that red light therapy, it almost the way I'm thinking about it, it's advancing the healing process.
Yes. And the red light therapy is one element of the light therapy that you can use. So, you can use high level lasers, you can use low level lasers. And
Mhm.
so I use both depending on the area that I want to stimulate and the amount of time that I have in order to do it. So I can get a change in brainwave activity using a higher level laser within seconds,
Mm.
and getting in, getting out stimulation, there you're done. And then working with that on a repeated basis to get a longer lasting change. And you can also use lower level lasers that are quite popular out there in order to stimulate some areas as well. You want to be sure that you're getting the proper area that you want to be stimulating,
Mhm.
because just like the good that it can do, it can also set you back if you're stimulating the wrong area.
Wow.
So that's important to know.
And what type of red laser are you guys like? Do you recommend or that you're using?
Oh boy, there are different types. I like directional lasers. You can also use those that you've probably seen them on a like pad, and there's a bunch of different low level lasers, not lasers, but diodes that can stimulate the brain, and they can be also generally effective if you
Hmm.
were to lay them over a general body area to create a
Right.
physiological response. So, you can utilize that. I liked to use, like I said, directional laser that allows me to be more pinpoint in what I do so that, well, I can be more specific in the outcome that I'm looking for.
Okay. Wow. That's pretty awesome. Well, wow. Lot going on with lasers. I was actually kind of more on the neurofeedback, and I'm like, okay, more laser.
Well, yeah, I mean, it's really, it's an expanding field and exploding out there. And the knowledge that is occurring is also growing with it.
No, definitely. I'm really excited about, there's a lot of new technology coming in, and also I'm excited about with government where we're able to, at least it looks like, we're going to be able to get more, use more I would say funds, and of course right techniques that we can help other people. I just want to say thank you so much for being here. You're a blessing. I love what you do. You're helping, not just one spine at a time, but of course one mind, and you're focusing on the full body. And if you wouldn't mind just kind of telling us where you're located at, and then of course just so where people can find you, and of course we have your phone number on the screen.
Sure. We're located in Ventura, California. And we have our website, schneiderchiropractic.com, and we're going to be updating that hopefully soon so that we can incorporate much more of the kind of work that I'm doing and love so much, and I'm very thankful to be able to engage in. So it's a pleasure to meet you as well.
Yeah, and thank you so much, doctor. And everyone, make sure you guys go check out the website. The phone number is on the screen. Website is on the screen, and we'll be having a lot of nice cuts of this video for the next maybe two to 2.5 weeks, so that everyone can hear what Dr. Daniel's speaking on. Thank you so much, and God bless you, my friend. And I'm sure we'll probably do this again.
God bless you as well.